I'm Nick Parasiliti. What am I doing out here in the woods? Well, I'm here to illustrate a point. The point is, emergencies are not always convenient. They can happen anywhere at any time. For example, maybe in the woods of Southwest Florida. As EMTs, it's our job to be prepared for these emergencies, no matter where they occur. And this presentation is to help prepare you for two different situations. Number one is shock, number two is respiratory illness. By the conclusion of this video, you'll be ready to face both situations. Let's begin by discussing shock. And to start with, what is shock? Well, all the systems of your body, all the cells, all the tissues, the organs, the organ systems, they require circulation of blood. That blood delivers the necessary oxygen and nutrients for that tissue to survive and thrive. If you don't have sufficient blood flow to those tissues, to the cells, they're deficient in it, and eventually it causes cellular and tissue death. Thus, we have shock. The causes of shock comes down to what's called the perfusion triangle. Triangle corresponding to three different elements. The best way I can think to illustrate this is think about the hose at your house. Your hose has the pump, which moves the water. Your hose has the hose itself, which is the vessel that transports the water. And of course, you have the water itself that's, let's say, watering the lawn or the plants. In the body, it's kind of the same way. The pump would be the heart. The hose would be the circulatory system, our veins and arteries. And the water would be the blood, actually what's being moved, which contains the oxygen that the tissues need. If one of those three elements is not correct, we get shock. Starting off, number one, cardiogenic shock. This is an issue with the pump. What's the pump? That's your heart right here. Could be injuries, could be issues of the heart itself, but either way, the heart is no longer meeting the demands of the body. We got problems. That's cardiogenic shock. Number two, this is called obstructive shock. When I think of obstructive shock, I think of either the ability of the heart to expand and contract is in some way diminished, or simply an obstruction is not allowing that blood to flow properly. It manifests itself in three different ways. Number one is tension pneumothorax, number two is cardiac tamponade, and number three is a pulmonary embolism. The second main category of shock is distributive shock, and this is an issue with the pipes, with the hose. In other words, in the body, our circulatory system, our veins and our arteries. Something has caused systemic dilation, meaning the arteries are very wide and we've lost pressure, lost blood pressure. And because of this, we have, again, hypoperfusion or shock. This manifests itself in a few different ways. Within distributive shock, we have four main types. Number one, septic shock. Septic shock is toxins throughout the system, some type of infection that's systematic and causing that dilation of the blood vessels. Number two is anaphylactic shock, caused by a foreign body intruding into the body and causing the immune system to be overreactive. In other words, something like a bee sting. Number three, neurogenic shock. We have an injury to the spinal cord, and this causes the dilation of the blood vessels below that level of the spinal cord. And finally, psychogenic shock. This is like when you get scared really, really bad. Again, that dilation causes a drop in blood pressure and we get a level of shock. The final primary category of shock we're going to talk about is hypovolemic. Hypo meaning low, volemic meaning volume. Low volume, thinking back to that analogy of the hose, it's like there's no water to be pumped anywhere. You don't have any water, you're not going to water your plants or your grass. You don't have any blood volume, you're not going to perfuse to the tissues and cells that need it. Now, this type of shock can arise from a number of different issues. It could be major hemorrhage, major blood loss caused by something like an injury. It could be illness that causes major diarrhea or vomiting. It could be a major amount of dehydration or major burns. Anything that's going to extremely lower the blood volume of the body can lead to that poor perfusion, can in turn lead to shock. What's the respiratory system? It's pretty simple. It's the system of the body that takes all the oxygen out here in Southwest Florida, gets it into my body, takes that oxygen and distributes it to all the cells in the body that need it so badly. It's the mechanisms of breathing and transporting that oxygen to the circulatory system. Let's talk about some specific respiratory illnesses. The first illness of the respiratory system we're going to discuss is asthma. Very common with children. This is going to be caused by a specific trigger in the environment that someone is susceptible to, or simply by exercise. Either cause, the symptoms are going to be a tightness of the chest, a major shortness of breath, and audible wheezing. Those bronchioles are very constricted and we're not getting enough oxygen in and out. The treatment is albuterol. It's a bronchodilator. It's going to help open up those bronchioles and allow that oxygen to flow in and out while we can transport them to the hospital for further treatment if necessary. The next respiratory illness we're going to talk about is again common in children. This is called pertussis. It's also called whooping cough. Now, pertussis is a bacterial infection. It causes coughing spells and it causes a very unique sounding cough. It sounds like a whoop. Next on the list is bronchitis, and as the name would assume, this is inflammation of the bronchi, those main branches that come off the trachea and start to lead towards the lungs. If those get inflamed, we have wheezing, we have major shortness of breath, tachypnea, and the body's working overtime trying to get that oxygen into the body. Treatment is going to be, again, a use of that albuterol inhaler and swift transport to the emergency room. Next on the list is a pulmonary embolism. This is a clot, a thrombus that started somewhere in the body, but eventually got lodged in a blood vessel of the lungs. Someone like this could be very cyanotic. They can have chest pain. They're going to have difficulty breathing, but their lung sounds are going to be pretty clear. Someone in this situation needs to be put on a non-rebreather, and they need to be taken to the hospital immediately. Next on the list is pulmonary edema. In this case, the heart is not working efficiently and effectively, and fluid is now backed up into the lungs. They're going to be hypoxic. They're going to be tachypnic. We're going to have lung sounds of rails. These people need CPAP, and they also need nitro to drain those coronary arteries. Next up is pneumothorax. Pneumothorax simply means that there's gas between the lungs and the chest cavity itself. Someone suffering from this is going to have absent lung sounds on one side of the body or the other. They're going to have a stabbing chest pain, and they're going to be hypoxic. They're going to need to be put on a non-rebreather and transported promptly. Pneumonia. Pneumonia is an infection within the lungs. Someone who's suffering from pneumonia is going to have crackle sounds within their lungs. They may have green or brownish sputum from that infection. The body's going to try to fight that infection, often causing a high fever. Someone suffering from this illness is going to need to be put on a non-rebreather or nasal cannula. CPAP is contraindicated. Next on the list is kind of a broad illness. This is COPD, chronic obstructive pulmonary disease. There's two different types. One is chronic bronchitis and the other is emphysema. These are both often caused by smoking or environmental factors. Someone suffering from COPD is likely to have phlegm, wheezing, rhonchi, and shortness of breath. Next up on the list is croup. Now, croup is a very unique illness in terms of its symptoms. It has a very distinct cough associated with it. It's called a seal bark cough. Now, croup is a viral infection of the upper airway, and someone that has it is going to need to be made comfortable and given oxygen. Next up is the dreaded tuberculosis, or TB. This one, we're going to want to make sure we have our BSI walking into a situation because it is highly contagious. It's going to cause coughing, maybe bloody sputum. It can also affect the brain or kidneys. This is a serious illness. This concludes my presentation on both shock and respiratory illness. I hope you enjoyed the video. I hope maybe you learned something, or maybe it refreshed your memory. And most of all, I hope it helped prepare you for the situations we will surely face in the field.